Hey, better, richer, stronger. Good morning again from New Jersey. It is a beautiful day today, and we are here again with our friend Mary Osborne, a person who has affected my life, my practice, my past, my then present, and my future. So I'll welcome you once again, and I'll welcome you with something that will relieve your stress at the moment. Mary is a devout Mariners fan and Yankee hater, and I am a devout Yankee fan and nothing hater, but so be it. Mary, welcome back. And
I was waiting for the other cap there.
Oh,
no.
oh, you want the other? All right, wait for the other hat. That's fine. So last week we talked about, in terms of the whole health practice, we talked about focusing on the health of your patients, and yeah, that's pretty much our intuitive response to this. But Mary, like with everything else you do, we take it two steps further, actually. Today, we're going to talk about the health of your team. And again, before we start, I just want to throw in a quick word about On the Ride, which is my program for young dentists and younger dentists who really need to find a way. And this was inspired by the way you do things, Mary. What we are doing is we are facilitating discussions for growth with practitioners, and the best answers come out of the group when it's facilitated by a good facilitator. And isn't that what we're doing here with the whole health practice? Synopsis very quickly what this course is all about, what this program is all about in Seattle, and then we'll take a deep dive into the health of the team. So the whole health practice, Mary.
Well, the whole health dentistry has to do with paying attention to the whole person and seeing things as a whole, as a whole entity. So whether that's the patient, seeing them as, I used to think that this was what I was supposed to pay attention to, is this really little narrow place right here. And then gradually I started to see that it wasn't tooth by tooth, it was a system. And then gradually I started to see that it was a stomatognathic system that I learned from my friend Herb Blumenthal. And then I have become more and more aware of the way in which everything that we do affects everything else that we do with our bodies.
Yeah.
And so the same thing is true of your practice. There's the health of your patients that are certainly a focus. And in my opinion, to the degree to which you have a healthy team, that is healthy relationships among yourselves as a team, is also going to affect the third piece of the puzzle, which is the health of your practice. And the health of your practice has to do with your ability to keep the doors open and make sure everybody gets paid, and it's a viable entity.
Yeah, and the team concept is very important. I think when I started in dentistry, we had employees, right? And the state still thinks I have employees of my practice. Then it became the staff. Yeah, all right, it's my staff. Then it evolved into team. And a team is a group of people working and growing together interdependently with similar goals on a common mission. And I've taken it a step further, and I think this is part of what I learn from you each and every day. What the people in my office are a community. Mm-hmm. I think we're a team that has each other's backs. And I think part of it is watching out for the health in every respect of the people that work with us. This stuff is stressful. It is taxing on our minds and bodies. So we've got to watch out for the people who work with us. We did, Mary, a little thing during the lockdown with you and me and Joan Unterschutz and Dave Karsten about the Great Resignation and the tension that existed between, at that time, the hygienists and the dentists, basically gut punching each other over health issues and safety issues in the office. So I think the lesson out of that clearly is we've got to watch out for each other. We got to watch out for the team.
And I love your reframe of the community, because it is about, there's an aspect of team that, of course, baseball analogies show up, and competition, right? Competition becomes part of it when we talk about teams sometimes, like two teams that are, might be fighting for for a place in the postseason or something like that. But community really is about coming together with a shared purpose.
Yeah.
And there's no hierarchy in that, right? There's a the
Correct.
community, or I won't say no hierarchy, but there's less hierarchy in a community. And so there's a way of coming together that is about understanding the mutuality of it, that that it's in my best interest. If you're a part of my dental community and we're working together every day, Alan, and we come to the same office every day, it's in my best interest for you to be well. It's in it for, and I mean that in every sense of the word, to be physically healthy, emotionally healthy, and for our relationship to be healthy. And it's in the best interest of the patients, and it's in the best interest of the practice. So
Yep.
it's not that we have to take care of people. It's that there's a mutual caring for each other. And those are that kind of mutual understanding and mutual respect comes out of the ability to have sometimes the difficult conversations.
Yeah.
For teams to be able to, I recall I worked in a practice where we had a practice visitation program and people would come and observe us as we worked with patients, and then they would spend the afternoon at our team meeting. And I remember one time we had a dentist and a couple of his team members who were visiting us, and he, at the end of the morning, when we started our team meeting, he just went on and on about what a great team we were, and he just had never seen a team work together the way we work together. And he was, we're like feeling pretty good about that. And then we had our team meeting. And at our team meeting, we had some contention. There were some issues that we were talking about what we were going to do. And there was some tension about that, some disagreement about it. And we had a conversation about it. We worked through it. We came to a decision. And at the end of the meeting, that dentist said, I'm feeling kind of stupid right now. We said, what do you mean? And he said, well, geez, I thought you were a great team. He said, I didn't know you had all this stuff going on. And I really realized in that moment that it's this stuff that makes us a great team.
Yes.
It's the fact that we all cared passionately about what we were doing. And so why wouldn't we have differences of opinion about how to get it done? Right? We cared passionately about what we're doing, but how we get it done is going to have differences of opinion about it. And so that's, I had to learn that the absence of disagreement doesn't mean agreement, and it certainly doesn't mean commitment. And so to me, the key is, how do we come together around a genuine shared purpose? And in my mind, in dentistry, if I boil it down to the simplest, the most essential piece of what is your role in the practice, it's helping people make healthy choices.
Yes.
And that's whether I'm a hygienist scraping teeth, or I'm an assistant sucking spit, or I'm a dentist making tooth dust, or I'm fighting with insurance companies. Whatever my role is, my primary responsibility that I try to keep in mind at all times has to do with helping people make healthy choices. And that's not selling dentistry, although dentistry gets sold in that process, right? It's about caring about an individual and believing that I can make a difference in their lives. And that's not what I learned in hygiene school. I mean, my job was to educate patients, to just give them information. And the dentist was the primary person who was responsible for talking about anything to do with dentistry, or anything to do with anything other than gums was pretty much the dentist's job. And I think that there's such a missed opportunity in dentistry for people who are not dentists. To have a rewarding and fulfilling, and to make a significant difference in the lives of the people that we serve.
And it starts with one another, is what I learned from you. If we can carry that culture, or as we say in New Jersey, culture, K-U-L-C-H-A, if we can carry that culture of caring for one another in our practice community, the people who work with us. I have had instances where I was at a break point And I remember Jess, my hygienist, who you know,
Yes.
just come up to me and just give me a great big hug and tell me it's going to be okay. And creating a safe space for one another where we could have those knockdown dragouts like you had in that practice, where we can go and throw ideas around and tell us nicely and gently that you're out of your freaking mind if you're going to do this, or yeah,
Yeah.
that's a good idea. Create that safe space for your admins, for your hygienists, for your assistants to speak freely. All of a sudden, you open up so that we can take care of each other.
And in that process, everyone is better able to take care of the people who were there to serve. Right?
Yes.
Everyone is in a better position to do that. I recall I was working with a dentist one time, and he came in and checked my patient, and I hadn't worked there very long at all, just a few months. And he checked my hygiene patient, and I had recommended, the patient had some perio issues, and I had recommended that I thought it might be a good idea for her to see a periodontist. And when the dentist came in to do the exam, he had a conversation with her, and he suggested that we see her again in 3 months and see what changes might have happened over in 3 months. And that was fine. And at the end of the day, I went to him and I said, Doctor, I want to understand better about how we decide when we're going to keep somebody in here and when we're going to send them to the periodontist. And he said, why do you ask? He said, do you have a question about something? And I said, well, with Mrs. Jones today, I was sort of thinking that she should go to the periodontist. And he said, well, listen, Mary, if you have a different opinion, he said, I'll call her. I said, what? And he said, well, you just spent an hour with her. You've been over every surface of every tooth in her mouth. You know the tissue, everything plus you know her better than I do, because you just spent an hour with her. You know about her life, and I know you know everything about her life, right? And he said, so, if you think that she should see the periodontist, he said, I can call her. That was, for me, the first time that any dentist I had worked with had ever really listened to me in that way and showed a level of confidence in not just my clinical skills, but in my ability to assess a patient. And as it turned out, it was, and I was really clear when he said, do you have a question? I was like, well, I'm not questioning your opinion, doctor. I know, I didn't say this, but I know you're the boss,
Yeah.
But he didn't hear it that way. He wasn't defensive. He didn't take it as an attack on him, or as questioning his competence or anything like that. He was genuinely able to listen and hear that. And the thing to me is one of the things that did for me was, it certainly, I felt better about myself, but beyond that, I was able to model that behavior when I worked with patients. Because the same thing is true there. When they question a recommendation or whatever, that I sometimes could get a little defensive, like, what? Yeah, what do you mean?
How dare you?
How dare you? Exactly. And so it was a demonstration on his part of what he said he believed. And what he said he believed is people are their own best doctor.
Yes.
What we believed was people are their own best doctor. And so if I'm my own best doctor, and my patient is my own best doctor, I have a different conversation with them. And so the questions I ask and the conversations tend to be different if I see myself in that way.
Mm-hmm.
Does that make sense?
Yeah. And circling back, I think it makes an enormous difference when that authoritarian top-down model gets knocked out, and a togetherness model, when you have a team that's working together toward a known mission, a known purpose, a shared purpose, all of a sudden and in a safe environment where we create safe spaces. The other word you taught me how to use properly is vulnerability. Where the team within itself can show a little vulnerability and open up to other team members seeing the blind spots that they're not seeing, that team becomes healthier and it functions on all cylinders nicely.
And is there to for the good of everybody, is there to support everybody. And in our last session, I talked about a time when I had gone to a course and came back with what I thought was an elegant way of communicating about periodontal disease, but really was not flying with the patients. When my other team members were able to come to me and say, Mary, that's not working. Like, lose that. And I could hear that from them. As much as I was attached to this particular picture, under a microscope of what a root surface looked like, and couldn't imagine why anyone in the world wouldn't be interested in that.
Oh, of course not. What,
I mean,
what are they, stupid?
who would not want to see a picture of a root surface under great magnification? And I was attached to that, but I was able to hear it, not as a criticism of what I was doing, but as a support, because they know what I want, and what I want is for people to feel, is for people to become healthier. And if it's not working, it's not working.
Yep.
Right.
To what degree is, if I could just take you off on a little bit of a tangent, something we learned last month in leadership that ties so well into whole health. To what degree does the doctors or the hygienists or the admins or the assistants' vulnerability and ability to communicate that tie into a healthy team? Is that relevant?
Oh, there's no question about that. The more, when that story that I share about going to the doctor, I had a picture of my role, and my role was to find out what the party line is on perio.
Yeah.
That's how I asked that question. I did not ask that question expecting the answer I was going to get. I really was asking it because I saw the doctor as the expert, and I was supposed to then be the expert on his behalf. Right. And I think the more, and that I do believe that is a part of our clinical training that does not serve us well, is the idea that we should be the expert, that we should have all the answers, rather than that we're fellow travelers with people. I mean, that's when, and this from the whole health workshop that you attended. I don't come to that as an expert. I come to that as a fellow traveler, because I'm interested in it. And the people who were at that workshop last year, and I'm sure we'll have that this year as well, were there to learn from each other, it's as much as to learn from me. That level of vulnerability, of recognizing just how much we can control and how much we cannot control, that's really a lot of what vulnerability is about, is can I show up and be honest, first of all, with myself about what I can influence and have control over and what I cannot. I have to tell you, the ultimate, the end of that is it's a so much easier way of being in relationship with people.
Yes.
It's, as a hygienist, to be the person who always had to have the answers is hard. Right? It's hard if that's your expectation. But if you feel like your job is to ask the questions and discover together with the patient, you discover really how people really are their own best doctor. That was sort of a thing I heard once. Patients are their own best doctor, but I didn't really get it. The more I was allowed myself to be curious, instead of having answers, to ask the next question, the more I learned that patients really are their own best doctor, that they have resources that I don't know about. They have ways of taking care of themselves that there's no way I could know about.
Yeah. And, I remember in dental school, and this was back in the late 70s, early 80s, that they said, let a patient talk enough and they'll tell you what's wrong with them. But they didn't teach us how to listen to them and how to, again, what I learned at that workshop, stay in that question, ask one more question, keep diving deeper and deeper. And I think it holds true with the team. It holds true with team to doctor. And of course, that then translates as team to that vulnerable human being that's coming in and saying, please help me.
Yeah.
Yeah.
Yeah. You know, a really, when I think about that whole process, one of the things that comes up for me, a key piece is the idea of changing behavior.
Yeah.
Okay. And so that's like, as a hygienist, I was taught, oh, you got to help people, you know, you got to teach them how to brush, and you got to teach them how to floss, and you got to tell them how to, the dangers of perio disease. And I mean, all of those pieces. And at some point, I can't remember exactly when it is, but at some point, what I realized was that people, if I gave people a chance, they knew how to do that. So I would go in. So my typical thing was what I was taught to do in hygiene school is I say to somebody, well, you should floss your teeth. And they say, you know, I don't have time for that. And I say, do you watch the evening news?
Yeah.
Right? You know, that's it. Well, yeah. Well, you could floss that. Like, so it was my job to figure out what they should do. And then not only what they should do, but how they should do it, when they should do it, right?
Yep.
It was my job to counter whatever resistance they had. And what I have come to understand is that there are a couple of things that if you just listen, you will, for the most part, you will hear ways in which people have been successful in their lives.
Yep.
Ways in which they have changed behaviors. And a classic for me, I mean, every health history I know has a question about, do you smoke? And have you ever smoked? And if somebody says, yes, I have smoked, and now I don't smoke, right? And now, as a former smoker myself, I count that right up there with having raised two wonderful sons as greatest achievements in my life.
Yes.
Is being a former smoker. But we don't even, I mean, for years, it's like, okay, good, you don't smoke anymore. Good, you're health conscious. But no, how did you quit? And so I always look for, whenever, this is sort of a key strategy for me. When I hear any change at all, any change in behavior, change in exercise, change in diet, change in relationship, anything that somebody does to better themselves in some way, they see a way that they can be better. There are always two questions that come up for me. And one of them is, what motivated you? Like, how did you come to that decision to quit smoking or to lose that weight or whatever? And the second question is, what strategies did you use? How did you go about it? And so I can give people my strategies. Like when I quit smoking, I hung out in places where I didn't typically smoke, like the bathtub, like a lot of baths. So I mean, but that's my solution. And that's, you know, that's sort of cute, but it's not helpful to that person. But if they can relate, if they can ground, we can ground them in success instead of in all of the times they've tried to do it and it didn't work. If we can ground them in success and have them recognize that they know how to make changes in their lives.
Yes.
They know how to do this. And we can also hear what motivates them. Because if we're going to be change agents, we better pay attention to what motivates me may not be what motivates the next person.
Yep.
And that's, again, that's that vulnerability, is recognizing it's not all about me. It's not, I don't have all the answers. And the freedom in that is I don't have to.
Yep.
I don't have to.
And it's once again, it's that great Maryism that I took away from last year's whole health practice, and not only stay in the conversation, but we learn how to stay in the conversation. It's real easy. Those 4 words are real easy to say, but it takes a real active synapse firing mind to take that information you just get from somebody, whether it's your patient or your team member, process it real quick and fire back another tell me more type of question, so that we learn more and more, so that we finally hit and motivate people to make their good choices. We could beat our heads against the wall, excuse me, and they're not going to floss their teeth. But if we capitalize on their other successes and they understand how important it is to do that, all of a sudden we go from, what did you teach us? From cooperation to compliance to the real C word, collaboration. That's how we make change.
Through a truly collaborative process. Guess what?
Yeah.
Maybe they don't have to floss. Maybe they have a better way.
Yeah.
Right? I mean, that's
we don't know everything.
we don't know everything. And I have, I mean, and that's the hardest part. And my experience is the more you do it, the easier it becomes. Not only easier to stay in the question, but easier to be in the question because you're
Yes.
curious, because you do
Yes.
recognize that that you can't come up with all the answers for them in a million years, no matter how long you know
Right.
them.
That's right. So what we're going to do, Mary, this is part 2, and we're going to tease you guys again because next week we're going to come back with part 3, and don't be surprised if we're wearing the same outfits, and don't be surprised if I have the same pair of hats here, and I could reach for. So smile, Mary. It's okay.
There you go.
But I want us all to have these little conversations where it doesn't tie you down for the whole day. And also, the more of this we get, the better we become. Mary, you'll be running a whole health practice conference in November. I will tell you that I and my team went out there last year. I badly want to be there this year, but my life is going to get in the way. This is something you really ought to do. And we are going to put a link to register for that practice. And please do it as soon as possible. This is something that is so worthwhile. Mary, you have changed dentistry for the better for the last few months. And you
Thanks,
continue to
Alan.
do so as the profession changes, evolves, and grows. You're a vehicle for growth and learning and real happiness in dentistry. So, Mary, I can't wait to see what happens with this one. I'll be out to the next one. Don't worry.
Thank you, Alan.
And everybody, if you want to learn more about this, the link will be on Better, Richer, Stronger. If you have questions, we'll put in a link to maryosborne.com, Mary's website. You could fire off questions from there. And please come back next week because the health of your practice is going to really determine how you can determine the health of other people. So next week, same time, 11 a.m. Eastern. Between now and then, please live healthy, eat right, get sleep, get exercise. Make somebody's life better each and every day. Mary does that for me every single day because I'm always thinking about stuff that she's taught me. And most of all, please, ladies and gentlemen, we have one shot at this thing called life. Enjoy the ride. I'll see you next week with Mary. Bye, Mary.
See you, Alan.